Congratulations guys and girls, we have just finished reviewing the HIV antivirals and we are just about done with this chapter. We're going to finish our discussion of antiviral medications, discussing the interferon treatment and hepatitis C therapy before we tie up some loose ends. So now let's talk about the interferons. Interferons are fascinating molecules. They're what's called glycoprotein cytokine. And do you remember what a cytokine is? A cytokine is a molecule used for communication between cells. Imagine it as a text message between cells. In response to viral infection, interferons are secreted by the infected cell to alert its neighboring cells that's infected with the virus. The interferons secreted by the infected cell interfere with viral replication by destroying RNA within the infected cell and activating immune cells and increasing host defense mechanisms. So if you remember back to cell biology, is this type of signaling from one cell to the cells around called autocrine, paracrine, or endocrine signaling? This is a form of paracrine signaling because it is alerting the neighboring cells or communicating with the neighboring cells. Autocrine signaling is when the cell communicates with itself, and endocrine is when an organ in one area of the body communicates with cells and tissue in other areas of the body through the bloodstream. An important thing about interferons is that they have anti-tumor properties in addition to being antiviral. The mechanisms of anti-tumor activity are too complex for our discussion, but in general, by destroying the RNA and activating immune cells, interferons have apoptotic-inducing properties which have been found to be beneficial in treating certain cancers. For the boards, it is important to be aware that there are three classes of interferons: interferon alpha, beta, and gamma. Interferon alpha has the most indications, and it is used for the treatment of viral diseases including chronic hepatitis B and C, Kaposi sarcoma, condyloma acuminatum. It is also used to treat certain malignancies including renal cell carcinoma, hairy cell leukemia, and malignant melanoma. Thinking back to virology for a minute, do you remember what virus causes Kaposi sarcoma? That's human herpes virus 8. Very good. And how about the virus that causes the condyloma acuminatum? Well, remember, condyloma acuminatum, are also known as genital warts, are caused by the human papillomavirus. Very good. Interferon beta is used for the treatment of multiple sclerosis. Thinking back to our neurology for a second, do you remember the disease process that causes multiple sclerosis? It is an autoimmune disease leading to the demyelination of the central nervous system. And do you remember the classic triad of multiple sclerosis? Mnemonic is, it's a sin. It causes scanning speech, intention tremor or incontinence, and internuclear ophthalmoplegia, and also nystagmus. Very good. Clinicians are not 100% certain as to how interferon works in the treatment of multiple sclerosis, but it has been shown to decrease the number of relapses and slow the progression of disease. Interferon gamma is used for chronic granulomatous disease, or CGD. Do you remember what enzyme is deficient in this disease? NADPH oxidase. Very good. But how does interferon gamma work in treating patients with CGD? Well, interferon gamma increases the release of superoxide molecules from phagocytes and improves their microbicidal properties. Interferon gamma has been found to decrease the relative risk of severe infections by 70% in patients with CGD. Side effects of interferons include fever, muscle pain, and neutropenia. The neutropenia is caused by both neutrophil apoptosis and reduced bone marrow production of leukocytes. Why it causes myopathy is less clear, but one hypothesis is that it causes systemic inflammation in combination with dehydration brought on by the therapy. And the reason it causes fever is by the production of various interleukins that lead to an increase in temperature of the body. Now let's discuss the three important therapies used in the treatment of hepatitis C: ribavirin, cimeprevir, and sofosbuvir. Thinking back to virology for a moment, do you remember what virus family hepatitis C belongs to? It is a flavivirus, which is a positive stranded RNA virus. Very good. And why is hepatitis C infection bad? Well, hepatitis C can cause serious chronic liver disease, including cirrhosis, and it is associated or commonly associated with hepatocellular carcinoma. Here's an image of cirrhosis that you might see on your Step 1 exam. Notice the hallmarks of cirrhosis, including the fibrosis and scarring between the hepatocyte regions. Also, we can see some lipid formation or lipid droplets here in this liver slide. These are hallmark findings in a patient with cirrhotic disease. Ribavirin is one of the oldest treatments used for hepatitis C, and it works by inhibiting the synthesis of guanine nucleotides by inhibiting an inosine monophosphate dehydrogenase. If we remember back to biochemistry, inosine monophosphate is converted into guanosine monophosphate by the enzyme IMP dehydrogenase. Ribavirin inhibits this enzyme and blocks the formation of guanosine monophosphate. Can you remember another drug that works on this same enzyme? That is mycophenolate, or an immunosuppressant drug used in organ transplants. In addition to the treatment of chronic hepatitis C virus infection, do you remember another clinical use of ribavirin? It is used in the treatment of respiratory syncytial virus, although a different medication is now preferred in children over ribavirin. Do you remember the name of that medication? Palivizumab is a new monoclonal antibody medication that is preferred to treat children infected with RSV. The next medication used in the treatment of hepatitis C virus infection is cimeprevir. Cimeprevir is commonly dosed alongside ribavirin and PEG interferon alpha, which is commonly known as the triple therapy. Cimeprevir, ribavirin, and PEG interferon alpha is known as the triple therapy. Cimeprevir works by inhibiting a viral protease, preventing replication. However, it can cause itching, photosensitivity, and a rash, but overall it is a well-tolerated medication. The final medication we're going to discuss is a new medication used in the treatment of hepatitis C, sofosbuvir. Sofosbuvir was recently approved by the Federal Drug Administration in 2013 for treatment of hepatitis C in combination with ribavirin or in combination with ribavirin as well as PEG interferon alpha. If we think about administering PEG interferon alpha, do you remember the 3 important side effects that are caused by the interferons? Well, we can get fever, neutropenia, and muscle pain. These are very unwanted side effects for a lot of patients. So sofosbuvir is a better medication because it doesn't have to be given with PEG interferon alpha. In fact, it can just be given with ribavirin and achieve high cure rates. Sofosbuvir works by inhibiting a hepatitis C RNA polymerase. And like I said earlier, it has achieved high cure rates and allows patients to avoid PEG interferon, which has a lot of side effects. An interesting point of controversy over this sofosbuvir new medication is the price of the medication. One course of treatment with sofosbuvir ranges from $80,000 to $170,000 here in the United States. So I'm sure you'll be hearing more about this controversy in the years to come and as you approach your clinical practice. Congratulations all! We have now finished discussing all of the antimicrobial medications you'll need to know for Step 1. In the past few hours, we've discussed the antibiotics ranging from cell wall inhibitors to protein synthesis inhibitors. We've discussed antimicrobacterial drugs used to treat tuberculosis and leprosy. We discussed the medications used to treat fungal infections like cryptococcal meningitis and candidiasis. And finally, we talked about antiviral medications ranging from medications used to treat seasonal flu to ones used to treat HIV. You made it, and I hope I helped you along the way. But before you close your video screen, let's finish off the chapter with some increasingly important topics in our field, infection control techniques. The boards are more interested in this sort of thing because infection control is being recognized more and more as super important to instill into our future doctors. The goal of infection control, obviously, is to control infection. But the way in which we achieve this goal is twofold, okay? One way is to disinfect, and the other way is to sterilize. It is important to recognize the difference between the two. Disinfection, in a way, is the lesser of the two, and it means to reduce pathogenic organism count to safe levels. For example, washing your counter with soap and water is a form of disinfection. Sterilization, on the other hand, is more serious and is defined as the inactivation of self-propagating biological entities, which is fancy talk for destruction of all living things. So in this case, we are destroying the pathogens. Another important feature of infection control is whether or not the method is sporicidal. And do you remember an important spore-forming bacteria that causes a lot of problems in hospitals? That's C. diff. Remember, C. diff, or C. difficile, is a spore-forming bacteria that is a bane of hospital floors that causes watery diarrhea in many patients. Spores are problematic because they are not destroyed by many common forms of disinfection. Here are some bacterial spores we're going to use to illustrate this concept as we discuss the infection control techniques. The 5 methods commonly used in the healthcare setting are autoclaving, alcohols or chlorhexidine, hydrogen peroxide, and iodine or iodophores. Autoclaving is heating up material in order to sterilize. In fact, it really is more than just heating. It relies on pressurized steam at temperatures of greater than 100 degrees Celsius. This is true sterilization technique, and it may be sporicidal. But think of it as putting things in a fire. Do you think a lot of things survive? Alcohol or chlorhexidine work by denaturing proteins and disrupting cell membranes. This is not sporicidal, and therefore spores continue to survive even with alcohol or chlorhexidine, but it is effective at killing viruses and bacteria on your hands. This is the stuff that you find as you walk around every hospital floor and even in the grocery stores these days. Hydrogen peroxide forms free radicals and oxidizes the bacteria to their death. This method is sporicidal. This is the stuff that makes your cut feel like it's on fire when you drip some of it on to sterilize it. So relate the pain to effectiveness. Hydrogen peroxide forms free radicals and oxidizes the bacteria to death, and it's very effective. Iodine halogenates DNA and RNA and may be sporicidal. This is the orange stuff that they use in the operating room as the final preparation before the surgeon makes his or her incision. So this stuff must work pretty well. So in review, we have extreme heat as an option in autoclaving. We can use alcohol and chlorhexidine. We can use hydrogen peroxide, or we can use iodine. The way they might present this in the boards is by presenting you a case of C. difficile in the hospital and then asking which is the best way to prevent spread of this disease. The answer you would want is hydrogen peroxide is preferred, autoclaving and iodine are the next best options, and you would not want to use alcohol or chlorhexidine since they are not sporicidal. Finish off the chapter, let's talk about the antibiotics to avoid in pregnancy. These include the sulfonamides, aminoglycosides, fluoroquinolones, clarithromycin, tetracyclines, ribavirin, griseofulvin, and chloramphenicol. A mnemonic to help us remember all these is that safe children take really good care. I want to use this as a review and a quiz for you. So let's go through each drug, and I want you to tell me what the adverse effect is for the developing baby. So in terms of sulfonamides, what is the adverse effect? Kernicterus. Very good. And what is kernicterus? Remember, it's the deposition of indirect bilirubin in the central nervous system. Do you remember why? Remember, sulfonamides compete for binding sites and displace the bilirubin traveling on albumin. This bilirubin is able to cross the immature blood-brain barrier and deposit in the CNS. Okay, moving on. How about aminoglycosides? They're associated with ototoxicity. Fluoroquinolones? Cartilage damage. Clarithromycin? They're embryotoxic. Tetracyclines? Associated with discoloration of teeth as well as inhibited bone growth. Ribavirin? It's a teratogen. Griseofulvin? teratogen as well. And what about chloramphenicol? Causes gray baby syndrome. Very good.